A dramatic new study has brought alarming news to the global health community. Superbugs are forecast to claim nearly 40 million lives by 2050 if drastic measures are not taken to combat antibiotic resistance. The report, authored by leading researchers and published in a renowned medical journal, underscores the urgent need for renewed focus and action on antimicrobial resistance, AMR. The relentless rise of superbugs, strains of bacteria that have evolved to withstand even the most potent antibiotics, poses a threat that could eclipse some of the deadliest epidemics in human history. One of the central figures in the report, Dr. Jennifer Wallace, emphasized that the escalating trend in antibiotic resistance is a consequence of overprescription, misuse of antibiotics in both healthcare and agriculture, and a lack of new drug development. We are on the precipice of a global health crisis, Dr. Wallace asserted. Without immediate and coordinated action, millions will suffer and die from infections that were once easily treatable. The study outlines several critical steps to avert this impending catastrophe. First, there is a call for stringent regulations on the use of antibiotics across all sectors. This includes setting global standards for prescription practices and severely limiting the use of antibiotics in livestock farming, which is a major contributor to resistance development. Secondly, there is an urgent need for a massive investment in research and development of new antibiotics. Over the past few decades, pharmaceutical companies have largely abandoned antibiotic research in pursuit of more profitable ventures. This has resulted in a dangerously thin pipeline of new drugs to replace those that are becoming ineffective. Finally, the report highlights the necessity of public education campaigns to raise awareness about the dangers of antibiotic misuse and the importance of adherence to prescribed treatments. According to the projections, low and middle-income countries will bear the brunt of the deaths, with healthcare systems already overstretched and under-resourced. However, no region is immune, as resistant infections know no borders. The sheer scale of the predicted death toll has caught the attention of policymakers worldwide. In a rare display of unity, governments, health organizations, and private sectors have started to come together to address this silent pandemic. The World Health Organization has pledged to spearhead a global action plan and calls upon nations to integrate AMR into their national health agendas urgently. In conclusion, the specter of superbugs looms large, and the clock is ticking. The forecast of nearly 40 million deaths by 2050 is not just a prediction, but a clarion call to action.
Don't forget to subscribe to the channel and hit the like button to stay updated with all the latest and exciting news. Subscribe now.